The following is not done in primary survey of trauma. So primary survey of trauma, the goal is to rule out any immediate life-threatening injuries. To rule out any immediate life-threatening injury, and that too at the earliest. Okay. Now we know the primary survey protocols are A, B, C, D, E. Now, if you remember in airway, did we do any investigation? So airway does not consist of any investigation. It's only clinical assessment. Max to max, you can get an X-ray of the cervical spine, nothing else. So yes, in airway assessment, I can go with X-ray. For breathing and ventilation, for pneumothorax, I would get an X-ray done. On an emergency, I'll get an ultrasound done. For circulation, we don't do any investigation. It is going to be basically to measure your system, I mean, your blood pressure and heart rate, and nothing more than that. These are disability limitation. Disability limitation is basically done on the GCS scoring, not on the basis of CT scan. So here, CT is done in secondary survey, not in primary survey. You rely on disability limitation only on GCS. Expose and examine is again a clinical component, nothing more than that. So what are the modalities you have used? You have X-ray, you have used ultrasound or GCS, nothing more than that. CT will not be done. X-ray can be done. In airway, I will intubate, and in emergency procedure for airway maintenance, that's for breathing and ventilation. If there's a pneumothorax, I'll put ICD. That is what we do in a primary survey. As I told you, CT is a part of secondary survey. CT is a part of secondary survey.